Dark underarms can be a source of embarrassment, but they're often not a sign of a serious condition. The skin condition acanthosis nigricans is a common cause, leading to thickened and darkened skin in areas like the armpits. Factors such as genetics, obesity, certain medications, and even hair removal practices can increase the risk. People with darker skin tones and those with a family history of the condition are more susceptible. To address dark underarms, lifestyle changes like weight loss can be effective, especially if obesity or type 2 diabetes is a contributing factor. Dermatologists may recommend treatments such as retinoid creams, chemical peels, or laser therapies. For those considering natural remedies, it's crucial to consult with a healthcare professional before trying unproven methods. Preventative measures include gentle shaving practices and using unscented moisturizers to minimize irritation. While dark underarms are typically harmless, they warrant a visit to the dermatologist if they're accompanied by symptoms like itching or odor, or if you suspect an underlying health issue. Sudden dark patches could indicate a more serious condition like cancer, so immediate medical attention is advised. Remember, treating the root cause often resolves the darkening of the skin.